Alert forecast. John?
All right. Thanks a lot, Chris. Okay, less than 2 months away from the Susan G. Komen Race for the Cure here in Charlotte. A wonderful event. I highly recommend everyone take part. Much of the money raised goes to pay for screening and help patients right here in the Charlotte area. And Maria Long is here with Novant Health Cancer Care and Dr. Stephanie Morgan from Mecklenburg Radiology Associates. And those are the premier sponsors for the Charlotte Race for the Cure. And we're going to talk about the money being raised and how it's used right here in the community, because I think a lot of times when we have events and things, a lot of people think, well, that money goes all across the United States or something, and a lot of people want to help people here, right here. So, Maria, tell us, how is the money distributed?
75% of all the funds that are raised from the race come right back to Charlotte. And we have been so fortunate at Novant Health to be able to be recipients of those dollars. We, this past year, provided 2,800 education opportunities for women that are uninsured in the community. We provided 589 screening mammograms. Wow. And we diagnosed 13 women with breast cancer. So thanks to those Komen funding, our program has been able to touch women and save possibly lives.
All right, so you see what you're doing when you participate in the Race for the Cure, and we always call it the Race for the Cure. It's the Race for the Cure. It's not a race where you have to beat everybody else. You can walk in the race, you can run in the race, you can if you want to, and you can have your good time if you want. But I want to make sure everybody's clear on that, because a lot of times they say, I'm not a runner. You don't have to be a runner. But Dr. Morgan, tell us, though, about the importance of these screenings, of which part of this money goes to fund.
Sure. So screening mammogram is still very important. Studies have shown that it can decrease death from breast cancer by up to 30%. So we still recommend annual screening mammogram starting at age 40 for our average age risk women. And then for women who are high risk, 29 to 39, they can actually talk to their doctor about additional imaging modalities. But the point of screening mammogram is to find that cancer early detection. That's what we want to do. Find that cancer before you or your doctor even know it's there. That leads to a better and early treatment and a better overall outcome and survival rate for our patients. So very important. We also offer 3D mammogram here in Charlotte, which is a very important supplement for screening mammogram. The vast majority of women can actually benefit from this. And what it allows us to do is even look at the breast tissue in more detail, find those cancers when they're even smaller, and actually help decrease what we would consider a false positive callback, meaning that we saw something on your screening mammogram, but you come in and there's actually not anything there. So that's another exciting thing that we offer here in Charlotte. But overall, screening mammogram is still very important that we're able to help those women who are underinsured and underinsured have access to these life-saving screening mammograms so that we can make that impact locally in our community.
All right, Dr. Stephanie Morgan and Maria Long, we appreciate you all being here. And again, it's less than 2 months away. It's in October. You need to get signed up because it is a wonderful, inspiring event, and you're doing so much good for so many people right here in Mecklenburg County. We appreciate you all being here with us today. Looking forward to it. All right, stay with us. Remember, you can register too. Go to WBTV.com/breastcancer. We want to make sure everybody knows you can go online and get registered. We got that information out there. All right, we'll be back right after this.